Okay, everyone, well, welcome. I wanted to run through a few different things for you real quick, just on preparing for your surgery and things that you might need to be aware of in the future as the days get closer. I put these two logos on the screen for a reason because, yes, as your surgeon, the technique and the experience is important, but I think the facility is another key element. And by doing this at a specialty hospital, we're ensuring that you have the optimal nursing care available, and we're going to hopefully optimize your outcomes and decrease the complication rate. Things to think about preoperatively. So you'll have some other information about this, but we really want to get your home ready for for after the surgery. So picking up rugs and things that are small items around the house that may be a fall hazard, something that you could easily trip up over afterwards. So try to clean things up, tidy it up a little bit. Any equipment that you may need is usually going to be given to you at the time of you're in the hospital. So you'll get that before you go home. This would include a walker, a cane, a shower chair, an elevated toilet seat. In the picture here is a couple of different things for total knee replacements. I recommend a cryotherapy device. That's what you see here. This adds cold compression for the knee. It's great for pain control and swelling. Unfortunately, insurance doesn't pay for that, so you have to get it on your own. Nutrition is very important. So we want to optimize you as much as we possibly can before the surgery time. I recommend men nutrition supplements that you see here in the picture. I'll have given you information about this already. Again, it's not covered with insurance, but it has been shown to speed up your recovery and decrease your infection risk afterwards. There's going to be some prehab exercises. It's very important that you do these in the days leading up to your surgery. This is going to pre-strengthen you for your recovery, and you'll more or less hit the ground running afterwards. On the day of procedure, so what to do? Arrive at the hospital about 2 hours before your scheduled surgery time. Bring comfortable clothes, something that you would wear to the gym, something baggy and loose fitting. You're going to be there at the hospital to exercise and get better and get the heck out of there. You're not a sick person in a hospital gown. Do not eat or drink anything after midnight the night before the surgery. The exception will be you can have water or vitamin water up until about 3 hours before your surgery. Do not drink coffee. Do not put creamer in. Water or vitamin water only. As far as medications go, in general, we're going to hold all of your medications on the day of surgery. There are certain exceptions, and I will be talking to you about that ahead of time. If you are in doubt, please ask. On the day of your procedure, you're going to arrive in the preoperative area. They'll have you change clothes. They're going to start an IV. You're going to get several medications there. And the idea is we want to hit the pain fibers on every front that we possibly can so that you don't have pain that ramps up after the surgery. So you'll get about 4 different non-narcotic medications. During the surgery, you're going to be under a spinal block. So your legs are numb from the waist down. So your body doesn't know what's happening to it. And that's tremendous for pain control and to decrease your bleeding risk. Surgery takes an hour. You'll be in recovery another hour, and then we'll have you back into your room with your family. When the block has worn off and you're ready to get up with therapy, we'll have you change in your regular clothes, and you'll be up walking probably about 2 or 3 hours after you wake up from the procedure. Possible complications that we look for, well, with knees, it's stiffness. If you lose the ability to bend, that's a problem. With hips, historically, it's been leg length inequalities or the risk of dislocation. All of these problems are pretty much a historic thing. We can prevent these things from happening by treating them aggressively on the front end. Any procedure out there is going to have a risk of injury to the vessels or the nerves. That's a surgical technique thing. We do everything we can possible to avoid those things, but that can happen during a spinal block, during a surgical procedure, during a nerve block, you name it. It's always a risk. That risk is very, very minimal. Blood loss anemia, I include this because people still ask about it. Blood transfusions are really a forgotten thing in the total joint world now. We have an extensive blood conservation program that starts with your preoperative lab work. If there's any risk factors there, we treat you for it ahead of time. We have multiple techniques during the surgery, medications that you get during and after the surgery to prevent blood loss. The need to pre-donate blood to give back to yourself, that's really long since been gone. So I would not really worry about the need to have a blood transfusion these days. It's been many, many years now since I've had to give one after doing just a standard hip or knee replacement. Blood clots are a real deal. If you get one, that can be a major risk to having a clot go to your lungs, and those can obviously be fatal. So that's something we really want to prevent. These are extremely rare nowadays. The number one way to prevent blood clots is movement. So by getting you up in a couple of hours after the surgery, we can really tremendously prevent this. When you're laying around in bed, you're going to be moving. You're going to be sliding the leg back and forth, pumping the ankles up and down. That is the number one best thing to prevent blood clots. You're also going to have these inflatable squeezers on your calves that you see in the picture here. Those have been shown to prevent blood clots. You'll get those to go home with and wear at night for the first couple of weeks. Everyone will get some sort of a medication. Predominantly, we use aspirin, but there are certain people for high risk for blood clots or maybe a history of blood clots that may be on a stronger, more potent blood thinner. We'll treat those people on a specific basis based on your medical history. Infection is always a risk. We have a very clean hospital. Part of that's being a specialized facility. Our infection rate is much lower than the national average. Even if and when we've ever had a spike there, our infection rates always stayed well below 1%, usually less than a half of 1%. Everyone gets a nasal swab with chlorhexidine. That's a good antibacterial. We all carry bacteria in our nose, in particular, some of the resistant bacteria. This is a good way of just pre-treating everyone to decrease the risk. You'll also be given this Hibiclin soap that you see in the picture. If you're from out of town, you can go to CVS or Walgreens or any pharmacy and buy this. I recommend that you shower at least one day, if not 3 or 4 days before the surgery, and just scrub down pretty much all over with this. It's a good way to decolonize your body from the normal bacteria and to decrease your risk of an infection. So when you leave the hospital, most people only stay overnight nowadays. There's exceptions always, depending on the procedure. And maybe if you're coming from far away from out of town, you might need to stay an additional night. You'll have therapy in the hospital. When you go home, you'll continue the therapy. Most of you will be given the AMP app that I'll provide for you. Your exercises will be on that app, and we have the option of doing outpatient physical therapy a few weeks down the road. Any equipment needed, again, will be arranged before you leave the hospital. I typically see everybody in 2 weeks after the surgery. Now, the exception is for someone who may be coming from far away. Those people, I may see them a couple of days after the procedure before you return home. If there's anything abnormal that happens after you get home, you obviously do not need to wait 2 weeks. I want to know about it. So never hesitate to call, email, reach out to the office. And if there's something concerning, we'll obviously get you in right away to make sure we can address any problems. When you get home, wound care is an issue. So I don't use staples or sutures anymore. All the incisions for the hips and the knees are closed with glue. Everyone can begin showering the day after surgery. It's very important. I want you to know not to submerge underwater in a bathtub or a pool for at least 4 weeks, if not 6. This is an example of a total knee replacement. I don't put an adhesive bandage on the knees anymore because they tend to shear when the knee bends and cause blistering. So this is a knee replacement at 2 weeks. There's still a little residual glue there, but overall the swelling's coming down, the glue's starting to fall off, and we have good skin healing. When the knees go home, you'll unwrap the ACE bandage, take a shower, and then rewrap the ACE bandage to help control the swelling after you shower. For the hip replacement patients, you have a honeycomb dressing that looks like this. It's transparent so you can see the incision underneath there. That way you can monitor it for redness or drainage and know if anything is going wrong. This dressing is waterproof and you can shower directly on it. I recommend that you remove the dressing on your own about a week after the surgery. At that point, you can leave it uncovered. Swelling is a big deal. All hip and knee patients have swelling. This can go all the way down the leg. Expect this. So ice and elevation is the key. When you're not up and walking and not doing your therapy, try to lay back horizontal, prop the leg up in the air, put it up on the arm of the couch just to get it elevated. Here in the bottom right is a wedge pillow. These are wonderful. You don't have to go buy one of these. You can obviously just stack up pillows, but when you're laying around, it's just, the point is to emphasize, you elevate the leg as much as you can. That's going to help keep the swelling down, particularly in the first week. Sleep is always an issue, in particular with knee replacements, more so than hips. And it's just hard to get comfortable in that first several weeks after the surgery. If you need it, we give you medications. I usually send people home with gabapentin, and that's one thing that helps. Melatonin is a natural over-the-counter supplement that can help. And if needed, I can occasionally give people prescription medication so that you can actually get some rest. When you return to work, a lot of that depends on you, how bad your joint was before, and what you do for a living. So, someone that sits at a desk at their computer all day, they can go back oftentimes in a week or two. A firefighter that's got to be able to carry 100 pounds and run up a flight of stairs may be closer to 3 months for that person. So we tailor it specifically to everyone, and I'll work with you on that to know when you're ready to return. Driving is the same thing. Everybody's a little bit different. A little depends on which leg you had operated on, and how bad your condition was before. But on average, by the second or third week, most patients are ready to drive. This really depends on you, how you feel safely driving, and how your reaction time is. I want you to be able to safely slam on the brake pedal if someone pulls out in front of you unexpected, so that you can prevent an accident. And obviously, you have to be off of any pain medications, but I will help you determine when you're ready to do this. Things to watch out for at home: expect bruising. You're going to have bruising hips all the way down to the knees. You'll have bruising all the way down to the foot. Warmth, redness, a little bit of discoloration is to be expected. It's normal. Don't be alarmed by that. Blood clots, though, are worrisome. So the normal swelling will fluctuate with activity. As you're up during the day, you have more swelling. You lay down, you prop the thing up, the swelling goes down. That is normal. With a blood clot, you have painful swelling with redness that goes all the way down the leg. You elevate it, and the swelling continues to get worse and worse, and that's a problem. So if you have concerns for that, do not hesitate to call. There's never been a phone call like that. I would much rather be over treating things than potentially miss an opportunity to keep something bad from happening. Infection is usually pretty obvious. You're going to have high fever. You're going to feel lousy. You can't put weight on the leg. You have foul smelling, cloudy drainage, and it's pretty obvious. You'll know. But when in doubt, give me a call, please. That's really it, guys. By now, I think you're ready. If you have other questions or concerns, please do not hesitate to reach out. This is going to be a great experience for you. If I can't say enough to people, don't listen to everything you see on the internet. Everyone's quick to go out and put out their horror stories, and that's usually what most people see. This is not going to be a bad experience for you. We will keep you comfortable. We'll get you moving quickly, and we're going to make this a good process for you overall. Thank you.